Welcome to The Explainer. All right, today we are tackling a topic that affects a lot of men: low testosterone and erectile dysfunction. We're going to break down the science and look at the whole spectrum of treatments, from what your doctor might prescribe to what you'd find in the supplement aisle.
So let's just start with a number that honestly kind of blew me away. This comes from a review in the Journal of Men's Health: 52%. An estimated 52% of men between 40 and 70 deal with some form of erectile dysfunction. I mean, just think about that. That's not some small fraction. That's literally 1 out of every 2 men in that age group. It really shows you just how common this is.
So here's how we're going to break it all down. First, we'll look at the challenge itself. Then, we'll dive into the hormonal side of things. After that, we'll cover the official medical guidelines, explore some natural alternatives, and then pull it all together with a clear takeaway for you.
Okay, let's get right into it. Section 1. What are we really talking about when we say erectile dysfunction, or ED?
Now, the clinical definition is actually super important here because of one key word: persistent. See, this isn't about a random off night, which happens to everyone. We're talking about a consistent, ongoing medical issue that gets in the way of a healthy sex life. And this diagram, it just perfectly lays out why this can be so complicated. ED is almost never caused by just one thing. It's this whole mix of stuff happening in the body. You've got vascular issues that affect blood flow, hormones being out of whack, something called oxidative stress, which is kind of like rust on your cells, and of course the psychological side of things. All these pieces work together.
That diagram is the perfect lead into our next section. Let's zero in on that hormonal piece, because it's a big one. What happens when testosterone is low? So when doctors say low, what do they actually mean? Well, the American Urological Association, or AUA, gives us a very specific number. They've drawn a line in the sand. Low T is when a man's total testosterone level drops below 300 nanograms per deciliter.
But, and this is a really big but, it's not just about the number. The AUA makes it super clear that a real diagnosis isn't that simple. You need two things. First, not one, but 2 separate blood tests taken early in the morning that are both below that 300 mark. And second, you have to actually have the symptoms that go along with it, like a drop in sex drive or feeling tired all the time.
Okay, so let's say the diagnosis is confirmed. What's the next step? What's the established medical game plan? Let's dig into the official guidelines.
When you look at what the AUA says, the potential upsides of therapy are pretty broad. Yeah, of course, it can help with erectile function and sex drive, but it can go way beyond that, improving things like bone health, helping build more muscle, and even having a positive impact on mood.
Okay, let's talk about the elephant in the room. This is the big question pretty much everyone has, and it's a totally valid concern for men and their doctors. Does this stuff cause prostate cancer?
And the AUA's conclusion on this is really, really direct. They say clinicians should tell patients there is an absence of evidence. Now, that's a huge statement. The old thinking was that giving a man testosterone was like pouring gasoline on a potential fire. But after reviewing all the data, the AUA says, we just don't see the evidence that it starts a new cancer.
All right, so with that medical foundation in place, let's pivot. Let's explore this other world that's getting a ton of attention: natural alternatives, or what the scientific community calls nutraceuticals.
So what are nutraceuticals anyway? Think of them as compounds from food or nature that are used for their medicinal benefits. They kind of live in this space between a vitamin and a prescription drug, and they're often used to try and tackle the root causes of ED in a different way. And if we pull up that diagram one more time, you can see exactly where these natural compounds are trying to work. A lot of them are designed to boost something called nitric oxide. That's a super important molecule for relaxing blood vessels and getting blood flow going. Or they provide antioxidant effects to fight off that cellular rust we talked about earlier. This table is really cool because it shows how researchers try to actually measure the impact of these things. You see a few popular supplements, how they're supposed to work, and then this IEEF score. That's basically a standardized questionnaire used to rate erectile function. So a bigger point jump means a more noticeable improvement for the guys who are in these studies.
But here comes the reality check, and it's a big one. The researchers themselves are super clear that we are still in the early days here. The evidence looks promising, for sure, but it's not a slam dunk yet. We still need bigger, better clinical trials, standardized products so you actually know what you're getting, and a lot more information on long-term safety.
Okay, so after all of that, what's the bottom line? Let's bring it all home and figure out how to put these pieces together.
Look, this isn't about saying one path is good and the other is bad. It's about understanding what they are. Testosterone therapy?
That's a highly regulated, medically supervised treatment for a specific diagnosis. Nutraceuticals, that's a whole different ballgame, often self-directed, with evidence and quality that can be all over the map. They're just two very different approaches.
And you know, there's one thing that both the official medical guidelines and the research on natural supplements shout from the rooftops: lifestyle is king. No pill or supplement is a magic bullet that can replace the basics like managing your weight, eating well, and getting some exercise. And any choice you make should always be a conversation you have with your doctor.
And all of this leaves us with this big, exciting question for the future. What happens when these two worlds, the established medical world and the emerging natural science world, really start to work together? What could a truly holistic, integrated approach to men's health actually look like? It is going to be fascinating to watch.